Hey, it's Dr. Chris, the Detox Dentist, and I'm here on Thursday. It's the Thursday live that we have around noonish every time, MST, Mountain Standard Time. I'm going to once again go through and read some of the questions in the comments from the videos that I've made, and this one probably will be mostly root canal questions from what I have seen. Now, I need to use these to read the questions properly, but let me go through that. Now, if you have questions, and I don't know how the chat exactly works with this, but if you have questions and you can get to a chat here, post them. If not, if you go ahead and post a question underneath one of my videos, I will most certainly be able to also answer them as I see the word question in the video. Okay. So I do see a chat. If somebody is online live, you can go ahead and ask them. Now I'm going to go through and see what the most recent questions are. So we have a bunch of questions. Oil pulling, X-rays, infections, P. gingivalis, and so forth. All right. I'm going to start with the lady who just, it's not a question, it's a statement. She said she just tried oil pulling for the first time with coconut oil and she brushed her teeth afterwards. I couldn't feel that brushing and multiple rinses. She couldn't get the feeling out. So, yeah, when you use oil pulling, you do it for at least 5 minutes, maybe 15 minutes as you get better. You are going to notice a difference, maybe not immediately, but you will notice a difference most certainly after a couple days. It's going to leave a different feel in your mouth. Specifically, your tongue is going to feel cleaner, okay? Your teeth are going to feel smoother because they are, they've been cleaned and they've been coated with a little bit of oil. You don't necessarily need to brush that off, okay? You don't need to rinse it off. You don't need to use warm salt water to get rid of it because it is actually good for you to have the MCT oil or the coconut oil in your mouth. All right. It is a little bit bactericidal, kills some of the bad bacteria, and it does make your mouth feel fresher. So if you do this as a routine for a couple days, I would bet you're going to feel a pretty significant difference. Next question or comment. Oh, look at that. Same person. Maria's 5088 mentioned an x ray showed infection in a tooth that had a root canal done. No surprise there. And it was tooth number 14, upper left molar, same one I had. It says, my case is difficult because I have a lot of missing teeth. Yeah, that is frustrating. I'm in my early 50s and I chew on my left side only. This is a very common problem. Nobody wants to remove a tooth. Okay, I don't want to remove a tooth. There's nothing better than a healthy tooth. And if you had a bunch of broken down teeth and one of them is a root canal, and now somebody says it's infected, it's difficult to make the decision sometimes to remove that tooth, right? I totally understand. Um, it says, we'll be seeing a holistic dentist to see what she will recommend. Um, I want to pull it because of my poor health, but I need something new to chew on. And it was problematic if 19, it would be problematic if number 14 is removed. Yes, absolutely. So the balance is, of course, chewing and not feeling good. Health, in my opinion, comes first. You can live without teeth, but you can't live very well or long with infected teeth. So, given that choice, I always err in the case in the direction of health. And we can replace teeth with ceramic implants. That works fantastically well. Zirconia ceramic. It is not cheap, neither is being sick for the rest of your life. So I would choose to remove an infected tooth, or, of course, see an endodontist and retreat. You have to have all the options. I chose to remove the same tooth in my mouth, and it was a life changing experience. You know about that. I did a whole video on it. And if you go to my, I guess, YouTube homepage, you'll be able to see my story of my root canal tooth that was removed. All right. Somebody posted Porphyromonas, gingivalis, and Alzheimer's are connected. So P. gingivalis, because nobody can say that first word. P. gingivalis is a bacteria that's in the mouth and it's found mostly in gum disease. So periodontal disease, it's anaerobic, meaning it is in an environment that doesn't like oxygen. So it's in pockets or around your teeth that are 5 millimeters or deeper. It's also found in infections, and that would include a root canal infection. It would also include infections in the gums, a gum disease infection, or infections in the bone, a bone infection or cavitation. And P. gingivalis is incredibly nasty. Okay, it's one of the worst bacteria you can possibly have. Why? Because we found it in, I think it was 96% of Alzheimer's patients' brains. Obviously, this was post mortem after they died, but we cannot kill this bacteria. Once it gets from your mouth infection into your brain, we cannot kill it. It is too strong. It has protective mechanisms. We can't cross the blood-brain barrier of the brain where the bacteria is hiding behind, and it creates all kinds of situations like amyloid plaques that we are looking at when we are looking for Alzheimer's. So it is a terrible thing to have. The longer you have it, the more you're going to have of it, and the more likely you're going to get Alzheimer's and possibly die from it. So infections in the mouth most certainly travel outside of the mouth. That's called that's the theory, the theory of the bacteria actually leaving the mouth and going somewhere else. Focal infection theory that the root canal dentists, doctors, and endodontists deny vehemently, but clearly they do move everywhere. So that was a very good statement. Yes, P. gingivalis is awful. Um, da-da-da. A lot of questions about personal situations that we don't necessarily need to bring up, but let's go to a lot of people questions about food and diet. I'm going to go to the root canal video, and that filters it out a little bit better. Let's go to this one. And we're going to go here, and then I'm going to pause it because I don't want it to start talking over me. All right, so here we go. We have 72 comments, and then the second root canal video posted about 3 weeks ago, and it's root canal versus extraction or removing the tooth. So if you need a root canal, would you pull out the tooth or would you save it? Or if you do pull out the tooth, what options do you have afterwards? A lot of people posted that they regret getting a root canal. Um, a lot of them, for instance, JK931 posted, I regret having a root canal. I experienced fatigue, probably, but abdominal pain, and so forth. And I decided to remove it, and I am perfectly healthy now. Common story. If you tell this to any endodontist, they're probably going to consider you a fraud, even if you're a patient, and run you out of the office. But my experience has been the same. Root canals cause all kinds of problems, and when I remove them, the patients get better. It's just what happens. It's not that I don't like root canals. I wish they worked, because if they worked, then we wouldn't have to pull so many teeth, and nobody wants to pull their tooth, including myself. But it doesn't seem to be the case. Moy, I guess that's the name, wrote, every root canal is infected and toxic. I try to tell people, but most do not believe. Thank you for telling the truth. I look forward to more videos from you. You're welcome, and thank you for the comment. Yes, you can never get rid of all the infections in a root canal. It is just a fact. Um, Another person, Rotten Taters, great name. I got a root canal 3 to 4 years ago on number 19, lower left molar, and it became seriously infected. Surprise, surprise. Just got extracted today. Good for you. I hate that dental insurance does not cover implants, and that is why I chose the root canal so many years ago. For a lot of people, $3,000 to $4,000 is hard to fork out upfront. 100% agree. This is a big, big issue. The cost of dentistry and the fact that dental insurance or dental benefits doesn't want to cover that is a sign of the times that does need to change. But you either pay for it now or you pay for it later. Health is the most important asset you have, and if it costs more now, make payments, get it done right, and then you can live a life significantly less inflamed and have a lot less problems down the line. If you punt the health down the line, it will catch up with you. So unfortunately, that is the case. So yes, congratulations, you made a good decision. Um, let's see what this person said here. Okay. This person wrote, "Thank you for the video. You're welcome. I went down this rabbit hole over the past few months and so forth, trying to figure out what to do, last minute decisions in the dental chair." And more. The person obviously has proved me a great number of more related videos. So what happens is once you watch a video of mine and this person recognizes this, you will be labeled a truther or a conspiracy theorist, same thing, and you will start getting more videos about what's going on with root canals and other things in the mouth. And before you know it, you'll know more than your dentist does. And when you do see your dentist, there will be no shock in the chair when they try to tell you something that is probably not the best decision for you. So, yes, educate yourself and start learning from people like myself. Good point. Um, this person says I have Norman9554-YHE. I'm not sure how you guys get these names. I have two root canals that always ache. I told my dentist, and she said the root canals were done correctly and that there was no infection and that some people keep feeling pain because damaged nerves on the side of the teeth. I requested her to extract the tooth, and she said no, because the tooth was fine and she would not recommend an extraction. That was 18 months ago, and now I'm having weird headaches and joint pain, so I'm changing my dentist. Good thinking. I found a biologic dentist, and he's going to help me with the extraction. Hopefully, he can help. Tooth pain is awful. Wow, what a common problem this is. And this is the problem with the profession. The dentist thinks they know better than you do. Now, let's make this very clear. The dentist works for you, right? You are the boss. Sometimes they need to hear that. You get to decide what to do with your teeth. If you want to pull a tooth, you get to decide to pull a tooth. If they choose not to do it, this person is correct. Find a dentist that will listen to you. Okay. An aching old root canal is a chronic infection. This dentist does not know what they're talking about, unfortunately. And your health, as you find out, got worse because of it. And once you get that, infected tooth removed, I would like to know how you feel. I would bet that you're going to feel a lot better, and I would suggest you write your old dentist a nice little letter so she can learn from your experience and hopefully grow a little bit as an actual healthcare provider. So, thank you for posting that story. Thank you. I love your videos. Thank you very much. I appreciate you saying that. Um, So this one says that interesting, doc, but what's the alternative for a young person with three infected upper teeth? An implant this early is really bad considering bones keep growing until 30s or even 40s. I'm curious to hear what you have to say about that. Well, a curious mind 6217. That is a very interesting question. Yes, bones do keep growing, but the vast majority of growth is completed between 19 and 24. 19 more for the females, 24 for the males. Biologic, of course. What else is there? Um, so when you are fully grown, the growth is very minimal, meaning you're always going to grow forward and out forever. That's the pressure, right? It's an arc as we open. So you're constantly pushing things forward. And that's going to make things grow forward. And that's going to make the teeth get crooked in front. And hence we have braces later on in life as well. Things don't always stay the same. But you don't need to wait past 24 to get an implant. There's not enough growth to make a difference. Plus, if you put an implant in there, it's going to keep everything more in place. It's kind of like keeping the stones in an arc, right? If you have the stones solidified in the arc, it's more stable. Get your implant before your health deteriorates. So if you have failing teeth, infected teeth especially, your health is going to deteriorate dramatically, while the implant would solve that problem, most likely. Remove the infected teeth. Very simple. All right, on we go. Let's see, it's 12:19. I'm only doing a short live today. Maybe another 10 minutes. I was looking forward to Deep Dive 4947 mentioned. I was looking forward to your follow-up video where you explained the exception case of buying time with root canal. because I have 3 to 4 millimeter apical inflammation under my second molar, and I have been rejecting both root canals and implants. I don't know about zirconia, so probably titanium, and let the necrotic tooth there now for a year. So what I think we're trying to say here is that you had an implant that failed, a titanium implant, and you have necrotic infected teeth, and you want to know how to buy time with a root canal. So this is the philosophy on that. If you are in perfect health, if you are young and your bone isn't fully grown, an implant is only an option if you are over 19 or 24 because the bone needs to be fully grown and you don't want to put an implant in because it doesn't move and it will cause issues with the growth of your jaw. So we don't do implants unless your jaw is fully grown. So that is going to be an adult, right? 19 to 24-year-old male or female. Number two, if you are extremely, extremely, extremely sick, chronically ill because of infections and so forth, removing the infection is the priority. You don't need to put something back in the bone if it is possibly going to slightly reduce your healing potential. So, zirconia implants are way better than titanium for many reasons. But if you have major infection in your entire body, chronic inflammation, autoimmune diseases, and so forth, my personal opinion is remove the infection, let things heal, then place the implants. I have seen implants fail, both zirconia and titanium. I've had to remove both titanium and zirconia implants because the body rejected them. Significantly more titanium than zirconia. Nothing is better than your own body, than your own tooth. Nothing is better than nothing there, okay, if you remove a tooth. Zirconia implant is second best to nothing or a natural tooth, and then everything after that is distant third or fourth. So, yes, buying time, you can do a root canal and keep the tooth in there if you are in excellent health or you are too young for an implant. If you're not in excellent health, probably not a good idea to do a root canal or an implant. Um, just on we go. We got another more good question here. I just had this is Spitzer 1113. I just had an old root canal treated tooth extracted because it was insanely painful. Nothing showed up on x-rays, but I convinced my dentist to just pull it. The dentist probably didn't take what's called a CBCT or a 3D scan. Often that does not show the extent of the infection. On we go. After extracting, it was noted there was a cyst on the end of the root. Surprise, surprise. If you don't know how to diagnose or look at infections properly, maybe you need to get a CBCT scan in your office so you can see these things ahead of time. All right. I have a couple of other root canal treated teeth that I'm now questioning if they should go. They don't hurt now, but I've noticed when sick that I get slight teeth pain. Yes, chronic inflammations will become more prominent when your immune system is down because it's trying to keep this chronic situation under control. When your body is sick and it's fighting too many fronts, too many battles, then chronic inflammation, such as root canal teeth, will often start to ache. And that shows you that there is a constant battle going on, the chronic part of the inflammation. Chronic inflammation is the root cause of most disease, and so you don't want chronic inflammation. The tooth that was hurting, that was insanely painful, that's where the body lost the battle, and good thing because it got you to pull out that infected tooth. I would have a biological dentist do a CBCT or a 3D scan to review those other teeth and see what is going on there. If you notice that your body or your health is deteriorating, then I would certainly look at those root canals as a first option of treatment, i.e., maybe removing them. All right, on we go. 5 minutes. I have an abscess. Okay. Smith63 said, I have an abscess at the moment. It's not very painful. My dentist gave me antibiotics, which haven't fixed it. The dentist said I need a root canal. I asked him to remove the tooth instead, but he won't as it doesn't need removing, according to who. Are there any naturopaths I could treat it with, please? All right. Again, super common problem. Dentist knows best. But let's go through the actual situation here. You have an abscess, which means there's infection in or around the tooth. It could be from the tooth or it could be from the gums. It's a periodontal abscess. or a gum abscess, or it could be a tooth abscess, or it could be an abscess that connects both. Okay, so a good dentist should be able to tell the difference. Next, they give it's not very painful. That means that the abscess or the bubble in your mouth is releasing all the pressure or all the pain that you would feel from the pressure in the bone. So you have an outlet, a drain, in other words. So that's pus constantly draining into your mouth. Kind of gross, but true. And that is causing you to relieve the pain. They give you antibiotics, which haven't fixed it. If you give somebody an antibiotic and it doesn't make the abscess any better, there's a pretty good chance the tooth is fractured. Now, if the tooth is fractured, it should hurt when you bite down or release. Okay? Antibiotics do not make fractured teeth feel better. Most dentists know this quite clearly. So the fact that it's painful and the antibiotics are not helping points clearly towards a fractured tooth. So the dentist said, I need a root canal. A root canal does not work for a fractured tooth because you're going to stuff the tooth with materials that are going to further separate the fracture. So the dentist hasn't realized that antibiotics didn't work, pain is still there, points towards a fracture. Fracture cannot be fixed by root canal. Therefore, tooth removal is probably the best option unless it is a periodontal abscess, which should have also had felt better with the antibiotics. So the long story short here is find a dentist who understands how teeth actually work. Doesn't even have to be biologic. Most dentists understand this. Maybe this guy or girl is new. But do not do a root canal on a fractured tooth. All right, on we go. Is there a risk of bacterial bone infection in removing a root canal causing permanent illness, or can it be stopped with antibiotics? Excellent question, Carolyn Bennett. Yes, I think the statistic says something like 80% or more of wisdom tooth extractions result in some form of cavitation or bone infection because it isn't done properly. Even if it is done properly, there's a small chance of bone infections. So, yes, you could end up with a bone infection that could cause chronic inflammation, which is, in my opinion, analogous to permanent illness. And can it be stopped with antibiotics? No, it cannot be stopped with antibiotics because antibiotics can only temporarily alleviate the symptoms of the cavity filled with bacteria and other nasty things that your body can't get to. So, a cavitation or FDOJ or bone infection is usually not going to be fixed with antibiotics. That's just going to make your biome even weaker and screw everything else up. So, what you need to see for this kind of case, you would need to see a biodentist to go in there and clean out the cavitation. One of those hot topics in dentistry that people don't like to discuss because they don't understand it, but that's really the only way to fix that. All right, we got one more, and then we are done for today. Let's find a good one. Let's just do one more video. One more video question. And I don't know if I can see anything here. Maybe maybe there's a question here. All right. So there's actually somebody who asked questions. Great. Okay, Meg RT Craft. Thanks for commenting. I will try to answer your question for you. I just got a ceramic crown because I had a crack in my tooth. It's been about a month and it still feels like it didn't heal yet. Tooth feels sensitive still, even though it's supposed to have been a root. Does that mean root canal? What should I do? How do I find a biodentist? Okay, I'm going to answer that question too, since I switched back over here. There you go. So, if it is a root canal tooth and it was possibly fractured, so you do a crown to try to hold those fractures together, it is very, very, very critical that the bite, the way your teeth come together, is perfect because the crack or the fracture can travel down the side of the root, and often we can't see how deep the crack actually goes. It doesn't matter if the tooth is root canaled or if the tooth is alive. A fracture will destroy the tooth, right? It's already dead if it's root canal, but it will be destroyed or cracked or separated if you bite too hard on that tooth. A root canal tooth becomes more brittle, like a dry tree branch versus a soft new tree branch. So when you bend it, it cracks rather than flexing, right? So any type of heavy bite on that tooth will possibly crack it. So what you want to do is you want to make sure the bite or how your teeth come together is perfect. When you go to the dentist and we adjust your bite after we cemented the crown, often it's not perfect because your teeth are sensitive, your bite is sensitive, your jaw has been open. We can't get a proper alignment. So if the next day or two the alignment doesn't feel absolutely perfect, or if you have sensitivity like that, you should go back and have the bite adjusted. Super, 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 super important. I would say the vast majority, probably 90% of the problems of sensitivity after a crown or an onlay or some kind of filling at all is fixed with a bite adjustment. And this doesn't matter. I do this as well all the time. You can't just make sure the tooth doesn't touch at all because the tooth does need to touch the opposing tooth. But if it's touching too heavy, it's going to cause problems. So get a bite adjustment. That would be the first step for anything that I would do. It should be free. It should be simple and quick, and maybe it takes more than one. Okay, so there you go. Thank you for that question, and I hope that helps. Thank you guys for watching the live. I'm the Detox Dentist. I'm here to unlimit your health. And I do this just because I feel there's a need for somebody to share this to the public. Biological dentistry is awesome. There is more and more of us out there. And I hope that the field keeps on growing and awareness keeps on growing. If you want a free copy of the Boss Diet, there usually is a link in the bottom that gives you a free copy of the Boss Diet. And you can also find out how toxic your body is from all the hazardous toxins out there. There's a free little link there as well. My company, Boss Oral Health, is where I do sell the products that I feel transform your biome, and that is how I try to help my patients through the Boss Biotics. And that is also usually linked in the comments. If you have any questions, as always, type question in the comments, and I'll find it easier and I'm able to answer them here on the Thursday Live. You guys have an